Partners in Prevention, a health and safety conference, was held at the Quattro Hotel over 2 days, wrapping up yesterday afternoon. Speaking about how workplace safety has changed dramatically over the years, On TV spoke with Workplace Safety and Prevention Services Territory Manager for Central and Northern Ontario, Trevor Beauchamp.
We are Workplace Safety and Prevention Services. We are one of 4 associations in Ontario that are mandated to help Ontario employers with their health and safety programs. This is a community conference. We have a planning committee made up of local employers here, so it's planned by the community for the community. So it's tailored to the people here in Sault Ste. Marie. 20 or 25 years ago, health and safety was all about hard hats and safety boots. Our theme this year is shifting landscapes in health and safety. And you fast forward 20 or 25 years, talking about substance abuse in the workplace. We're talking about legal marijuana and the effect on health and safety in the workplace. We're talking about mental health as a health and safety hazard that we have to respect and try to control somehow and try to protect people from all those hazards. Totally different landscape, and it's changing at such a rapid rate. It's amazing. It's very insightful. We've had several speakers speaking on a lot of the topics around mental health, and we're still doing a lot of traditional health and safety stuff, new ways of doing workplace inspections kind of thing, just to keep it fun. We just had a keynote speaker that talked a lot about self-care and looking after yourself. Make yourself number one, manage the space around you, manage yourself kind of thing. So touching on a lot of traditional things and also touching on a lot of the new stuff that we're seeing, like substance abuse in the workplace, like the opioid crisis. That is a big topic for us as well, and the effect on workers in the workplace. We have everything from your seasoned health and safety professionals to people starting out in health and safety. We have people who have responsibility for health and safety, which is pretty much everybody in the workplace. So we have a wide variety of people. We try to have something for everybody. One of the key things, though, is we give a lot of time around lunchtime, around breaks, and around the trade show exhibits to give a lot of people to get to know give a lot of people a lot of time to get to know each other. Because there's nothing better for somebody starting out than to meet somebody who's been in there for a while and start connecting.
The OPP said yesterday that fatalities are down significantly this year on roads that they patrol. The OPP said 58 people died on roads from January 1st to May 5th, compared to 97 road fatalities during the same time period last year, and that's a 40% decrease. The Canadian Association of Chiefs of Police is currently coordinating Canada Road Safety Week, a national campaign that began on Tuesday and runs through the long weekend. The OPP said 45% of fatalities so far this year are linked to speed, alcohol or drugs, distracted driving, and lack of seatbelt use, the so-called Big Four. Canada Road Safety Week, a national campaign that began on Tuesday, will run right through the long weekend. According to new data that gives a glimpse into the national costs of helping residents leave floodplains, flood-ravaged provinces are asking the federal government to provide almost $138 million to move or buy out homeowners affected by previous year's inundations. Calculations based on previous experience suggest that the total cost of giving up on 100,000 of the most endangered structures could run into the billions. Public Safety Canada says provinces and territories have asked for $137.9 million in federal money to help cover costs related to 10 floods. But the dollar figure is only an estimate and doesn't include this year's. The department says it expects to get more requests for financial help to relocate homes as the frequency of extreme flooding increases, and wants to know how much provinces and territories have spent on it without federal help. All that data will feed into a debate that governments are having about whether it's better to move people off floodplains rather than repeatedly pay for repairs.
That this is a health and safety issue. We are not able to access these products legally. People are either using black market product, and these products are not traceable. There are potential claims on these products that may or may not be correct. So it's actually a safety issue right now.
5 dogs were a big hit on Parliament Hill as veterinarians lobbied for legal changes that would allow them to prescribe medical cannabis for animals. They stood outside the main doors of West Block, capturing the oohs and ahs of politicians and staff as they emerged after question period yesterday.
So as a veterinarian, many dogs and cats like Max come to our practice all the time, looking for some alternatives in some cases from traditional medications that they're using. And as you know, with the Cannabis Act in place, many people are affected in a positive way through some of the therapeutic benefits that they're seeing on the medical side in people. And all mammals have an endocannabinoid system, and through research and through people using the products anecdotally, we know that there are some potential benefits in the same way people benefit from the use of these products for pain, for anxiety. We know for pets that affects them in the same way.
A police officer and a firefighter were injured in a shooting in Appleton, Wisconsin, and several others were hospitalized. Appleton police officer Megan Cash didn't say if a suspect was caught, but she said there is no threat to the community.
So what we know right now is Appleton officers and Appleton firefighters responded to the Valley Transit downtown Appleton today for a medical call. While there, the situation was very active, and there was a shooting that took place. We have several people that were transported to the hospital. At this point, we don't know the status of anybody. We do believe one officer was injured, and so it's going to be a hard day for us. I do know that they have that scene contained right now, and we don't believe there's any fear or issues in the public that we need to be concerned about. We have that scene locked down, and we don't see there's any other anything that we need to be concerned about.